Hi guys, and welcome to Rite Aid's very first Facebook Live. Tonight we're talking all things flu. I'm Chris Altman, a doctor of pharmacy and certified immunizing pharmacist from Rite Aid.
And I'm Dr. Jennifer Caudle. I'm a Rite Aid brand ambassador, a national health expert, and also a family physician. And I'm so excited to be joining you, Chris. This is National Influenza Vaccination Week, so we have lots to talk about with the flu. Flu season is really starting to peak, and this is all about protecting ourselves and our families and our loved ones. It's really time to get the flu shot. So I always say, unless you want to run the risk of getting the gift of the flu this holiday season, it's important that we get our flu shots and encourage our families to do that too.
Holiday season is the time to travel, see friends and family, and
Yes.
relax and have fun. It's not a time to get sick. That's why we really recommend following the CDC, and they say get that flu shot. It's the best way to protect yourself.
Yeah, it really is probably the single best way to protect ourselves, right? And the CDC recommends that, with rare exception, all healthy people 6 months of age and older really should get vaccinated. And once again, if I can't say this enough, if you haven't gotten your flu shot yet, it's really not too late to get it.
And what's great with Rite Aid is we make it as convenient as possible for you. We have thousands of locations across the U.S., and get this, 11,000 certified immunizing pharmacists.
Which, by the way, I have to say is pretty cool because you guys as pharmacists, many of you are certified to give immunizations, and that's kind of unique, right?
It is. It's great. And what's even better about it is how convenient it is for a patient to get that vaccine.
Yeah.
You can stop into any of our locations, no appointment necessary, head back to the pharmacy, and we'll take care of the rest. Show us your insurance card because chances are it'll be covered by your insurance, and we'll take care of all the billing, including Medicare Part B. If you don't know where your closest Rite Aid is, you can visit riteaid.com, use the store locator, and find that closest store.
Yeah, it's really great that it's so convenient, and I often think about that. As a family physician, I love seeing my patients. I love it when they come in to see me and get shots and things like that, but the truth is you don't have to just see me or schedule an appointment with a doctor to get a flu shot. You can go to the Rite Aid, which is really what we're talking about. Really the most important thing is not putting off getting that vaccine. That's really what I don't want people to do. So drop by your local Rite Aid. You can probably drive by, most of us probably drive by a Rite Aid almost every day. And I also say, like, when you're shopping for shampoo or you're getting like your toiletries or paper towels or whatever, you could also head right to the pharmacy and get your flu shot. So it's a win-win.
And it's great because our pharmacists are all professionally certified to give immunizations. And it goes beyond flu. We can do flu, we can do pneumonia vaccines. If it's been time, it might be time for your tetanus booster. So we can take care of all of that for you.
Right.
At Rite Aid, we can vaccinate children, we can do seniors, we can do adults. I've done them all. So what's great about Rite Aid is we try to give you that best experience possible getting your immunization.
I think it's awesome. And by the way, for those of you who get your immunizations at Rite Aid, which is pretty awesome, just make sure that you bring me, your doctor, the record saying what you got so that I know.
Yeah.
Very important.
So there's a lot of misconceptions, a lot of myths in communication that has really confused some of our patients out there. And that leads to the excuses as far as why our patients aren't getting vaccinated.
Right.
We're going to help break down all those myths and miscommunications today on air, and we really encourage you guys out there to leave a comment and question in the comment box.
Yes.
That we can get answered live
write
on air.
us. Yeah, write in the comments. Send us your questions. We want to hear.
Yeah, we want to have fun and make sure that you guys get the information you're looking for.
Absolutely.
I think the best one to get started with, and this is probably any time we say something about a flu shot, we hear it all the time in the pharmacy, and it's probably the elephant in the room when we talk about flu shots.
Right.
My patients will tell me, I don't want to get my flu shot because it's going to make me sick or it's going to give me the flu. How do you talk to your patients about that?
Well, first of all, if I had $1 for every time someone has told me that they didn't want the flu shot because they were afraid they were going to get the flu, I would be a very rich woman. And you might be a very rich man as well. This is something I hear all the time, and I imagine you probably do too. I understand why people are sometimes concerned that they got sick from the shot. In fact, I've sometimes gotten sick around the time I got the flu shot. But what's important to keep in mind is it's not the shot that made us sick. For the flu vaccines that are injections by needle, they're made of either an inactivated or killed virus or doesn't have a virus at all. So it's not possible for that vaccine to give us the flu. So you say, well, people say, well, then why did I get sick? Why did this happen? I think it's important to remember it takes 2 weeks for our body to build up immunity to the flu virus once we get the vaccine. So if you get the vaccine and then you get exposed, you could still get sick. And plus, there are plenty of other viruses and bacteria running around in the environment that make us feel like we have the flu, right? Like, the flu is not the only one. You could get a different one, but it feels like you have the flu. And I'd say finally is remember our flu vaccines. And I know you know this as a pharmacy, are made up of the 3 or 4 most common flu strains in a season. It doesn't protect every single possibility of a strain, so it's possible to get a different strain. But the flu shot did not give you the flu, I promise.
That's really good. I think hopefully that answers that question.
Yes.
That's like Dr. Jen said, it's something we hear all the time.
All the time.
So another one we hear from our patients, we'll be talking about getting the flu shot. And, they'll say, well, I don't need to worry about it because it's just the flu, right? It's influenza. Everyone gets sick. And they don't really understand the severity of the disease.
Right.
So when you're talking to your patients, how do you describe exactly what influenza is and what the severity of it is?
The severity of it is. You know, before I answer that, I want to know from you, like, you're on the pharmacy side, right? So you see people coming in probably when they're picking up prescriptions and stuff like that. Are you surprised at maybe people feeling that it's more severe than they thought? Or, I mean, what are your impressions? And then I'll tell you mine.
Yeah, sure, absolutely. I think, you know, the one thing that always surprises me is when we do talk to a patient who has been sick with the flu, no questions asked, they say, I want to get that flu shot. Because when they get sick, they know this is serious. This is something that really affects me.
Right, right.
And then the other side of it, too, is we see them coming in for treatment, getting the over-counter stuff to manage those symptoms. And they're like zombies walking back to the pharmacy.
Miserable.
Yeah, just completely out of it, talking about those body aches and pains, and it's really bad to see them like that.
Right, right. No, and you're right about that. Millions of people every year get the flu, and I think a lot of people don't realize that. But the other side of that is hundreds of thousands of people are actually hospitalized from flu complications, right? And not only that, but tens of thousands of people actually die from flu-related complications. I know that's hard to believe for some of us, especially if you're healthy. It may be hard to believe, but it happens. So it can be very serious.
So another common myth we hear, and this is one that even among my friends.
Yes, and my friends.
when I'm not in the role of pharmacist, I'm still a pharmacist when I go home. So I talk to my friends, and young, healthy adults will tell me, I never get sick, or I take good care of myself, so I don't need the flu shot. How do you really work through to get them to understand that they still need to get vaccinated? Yeah,
well, that is something that people often say. They say, I'm never sick, why should I get it? And I say, for that person out there that never gets sick, that is awesome. That is really wonderful, and that's what we really want for everyone. But it's still important for that person who doesn't feel like they ever get sick to still get the flu vaccine. And the reason why is because if you were then to get a flu virus, the vaccine can hopefully make those symptoms less than what they would normally be. And also, it helps protect you, by you getting vaccinated, helps you protect other people in the community. So that's super important. And we've got our first question. I love it. It looks like Joy has written us. And Joy says she had a bad reaction to the flu shot a few years back. What's the best advice for helping her stay flu-free during the flu season? You want to take a stab at it?
Sure. So I'll jump on this one here. And I think the big thing here from my perspective, I mean, there's some healthy habits that we can try to practice to stay healthy. Sure. But the one thing for Joy is to think about all those other close contacts she has.
Right.
Friends, families, relatives, whoever she's around with, making sure that they're protected. So being that proponent to say, okay, I can't get it, but you should get protected so you don't get me sick.
That's right.
I think that's it's a really good thing to help. Joy can advocate to those other people who can get protected to get the vaccine.
Right, and something I would say too, Joy, you mentioned that you had a bit of a reaction, and there are some people who feel like they have either an allergic reaction or some sort of adverse reaction. That's really important to know about and to really talk with your doctor about, because you want to be clear about what type of reaction that you possibly can have, because that can determine what future shots you may or may not be able to get. So that's another point I just make a comment about. So let's see here. So people often say, let's talk about this one. Now this is like a misconception myth or so. People say that, well, I got my flu shot last year. I don't need to get it again, doc or pharmacist. Do I need to get it again? What do you say?
So that's a really good question, and it's one that comes up in pharmacy a lot, because we start offering the vaccine when it's released. So in some cases, we're trying to vaccinate those patients maybe in September, maybe in August.
In August, right.
So they'll be telling us, well, I got my flu shot
in January.
This year. Right. So I had it January 13th. They'll tell us the date they got it. They know exactly when it happened. But I think the one thing to keep in mind is that every year it's a new vaccine. So every year we're getting something out there to really protect them against going to be most likely circulating in the environment.
Right, and even if it's the same calendar year, like if you got your vaccine, the last year's one in January and this one you got in September, it's still a different flu season. And as you mentioned, scientists really work hard to predict which flu strains are going to be circulating, and it often changes. And I think another thing people don't think about is that flu vaccination, the immunity often wanes over time as well. So even if you got it in January, for example, you still got to get it in August, September, October again.
Oh, we have another question. This one's coming in from Chase. He says, is it too late to get the flu shot?
Well, Chase, I'm so glad you asked that. I'm so glad you asked that because I have a feeling that many of you watching are probably going to be able to guess what I'm about to say. The big answer is no, and that's also the good news. Now, we know the flu season technically goes right from October to May, but from December to January, February is when flu activity tends to be the highest. We're going into heightened season right now. So, Chris, it's not too late for you to get the flu vaccine. Go out and get it. Very, very important.
That's really good. I think, at the pharmacy, we talk about, vaccinate until we don't have it anymore. So until it's gone, we should keep giving it if you haven't gotten it.
That's right. That's right.
So we've talked a lot about, that flu vaccine as being really the #1 way to protect our patients. But there's some other stuff we can do, and we kind of alluded to some of them, but do you want to kind of walk through what our patients can do outside of the vaccine?
Sure. Well, I say prevention, prevention, prevention. I mean, if I could say it all day long, I would, because when we're in our sort of cold and flu season, we've got to make sure that we're doing proper things to keep us protected, as you mentioned. So washing hands, very important, and washing hands consistently, making sure that we're using warm water and we're using soap and we're washing for 20 seconds. I often tell my patients to sing the song, Happy Birthday. That'll get you through washing your hands. Make sure you're washing all sides and getting under the nails. That goes a long way. But also, if we've got a sneeze or a cough or things like that, remember these respiratory particles really can travel far, and that's what we think often spreads the virus, the flu virus, as well as others. So if you've got a cough or sneeze into your elbow or into a tissue, and then make sure you throw that away, and of course, washing your hands. But, make sure you disinfect surfaces, very important. And if you're sick, stay home. Please don't go to work or go to school and just infect everybody, everybody else. We don't want you to do that. So,
looks like another question came in.
Yeah.
This is from Kimberly. She says, how long is the flu shot effective for, and can you get the shot too early?
That's very interesting. Yeah, I'll take this. Well, I'll take a stab at this one. So, Kimberly, really, really great question. So, how long the flu shot is effective for really depends on a number of factors. It depends on the actual vaccine, but it also depends on patient-specific factors in terms of how well it works in their body, your age, your other medical conditions, etc. So there's a number of things that go into the mix there. But this is what the CDC recommends, is that you get the vaccine as soon as possible in the season. And can you get the shot too early? The theoretical answer is you might get it at a point where it starts to wear out, but remember the benefits of getting the shot outweigh the risks of not getting it. And the CDC wants you to get it, and we want you to get it as soon as possible to make sure you're protected. That's the best risk to take, is to get it as early as possible. So that's what I recommend.
Yeah, I think that's really good. The one thing to keep in mind is that when we talk about when the vaccine is actually made available, the CDC controls that. So, so they're watching to say, when should we start releasing those lots and get them out to the public?
Right.
So we talked a lot about protecting ourselves for the flu.
Yes, yeah.
But I don't know that we've talked too much about what is influenza and then what's the common cold. Because our patients often come to the pharmacy, they'll have all these symptoms and they'll say, I don't know what I have.
Right.
And they're kind of looking for that guidance. How do you describe the differences between the two?
Yeah, well, sometimes even as a physician, I tell you that sometimes it can be hard for us to distinguish between a cold and a flu because many of the symptoms actually overlap. I think two main things that we should always keep in mind is that the common cold is typically caused by rhinovirus. It's a virus, but a different one than the flu, which is caused by the influenza virus. So first off, they're two separate bugs, two separate viruses. But some of the symptoms that tend to be similar are things like, a cough. You might have a little bit of a stuffy nose, runny nose. You might have a sore throat, things like that. But what tends to be different is fever. You may have a little low-grade fever when it comes to common cold. And I think we have some things on a graphic here, so make sure you check out that graphic. You might have a little low-grade temperature with the cold, but with the flu, the temperature is going to be higher most likely and may last longer. And the body aches. I mean, have you ever had the flu?
I have, and it's
I've
all
had the flu,
over.
and I mean, I have patients and myself, you feel like you've been hit by a bus because you get body aches, muscle aches, and the fatigue can be absolutely exhausting. Those are symptoms that you don't have as extreme symptoms with the cold. So it's worse with the flu.
So let's say one of your patients, they
Yeah.
come in the pharmacy, they come see you at your office, and they've got those telltale signs of flu, and
Yeah.
you're looking at them, you say, this is flu, I know it.
Yeah.
What do you advise your patients to do at that point as far as what they can do to help manage it?
Right. So I talk about some of the things we've already talked about, which is hand hygiene and prevention and making sure you're coughing and sneezing appropriately, disinfecting and things like that. But as you probably know, and I'm going to put you on the spot in just a second, but we do have something called antiviral medications that are okay and good for certain people. So, I mean, you're the pharmacist, our neighborhood pharmacist. So do you want to tell us a little bit about antivirals and how they work?
Sure.
Yeah.
Antivirals they're medications that your doctor can prescribe for you if you have influenza. What they do is they help decrease the severity of those symptoms.
Right.
So rather than being hit by a bus, maybe you're hit by a scooter. So it takes those symptoms down a little bit. Plus
Right.
it helps decrease the overall duration. So
Right.
it'll help really overall minimize the experience you have. But there's one real important thing here, and this is something that a lot of our patients have a hard time with. You got to get that medication started quickly.
Yeah.
The recommendation is to start that within 48 hours
Yes.
of when you first have flu symptoms.
Right.
So it's
right.
real important you get in to see your doctor as quickly as possible.
That's right, because if you come to us and we think you have the flu, but it's been after 48 hours, these antivirals are really not recommended. You know, they're not, what we would recommend. So that's, I think it's a really good point, and thank you for explaining that. We have another question. I love the questions, guys. Keep them coming. Julie, thank you so much for writing, and you're asking a great question. Julie says, at what age should I vaccinate my baby? Great question. I'm so glad that you asked about baby too, because a lot of people don't know that babies should be vaccinated. But the key here, kind of like what you were talking about with antivirals, is there is an age cutoff, okay? It's children 6 months of age and older. So if you have an infant, 2 months, 3 months, anything less than 6 months should not be vaccinated with the flu vaccine, okay? And there are a few other exceptions when it comes to people who should not be vaccinated. But for the most part, and with rare exception, most people over the age of 6 months, okay?
That's really good. I think just to add on to that, to think about for those children that are under 6 months,
Right.
parents, adults, grandparents,
Right.
caregivers, make sure everyone in the house that's going to be around that baby is vaccinated, because until they reach that age threshold, they're at risk of contracting.
And that's actually one of the reasons why we recommend that everyone get the flu vaccine, even if they don't feel like they get sick, is to help little babies who can't get vaccinated or people with weakened immune systems, things like that, right? Yeah. So when it comes to fighting the flu, I mean, I think you guys, I mean, you know I think the world of you and, and your profession. Pharmacists are really a valuable partner, and physicians feel like that. You know, you guys are really on the front lines. We're on the front lines of healthcare. And honestly, as a physician, I've said this for years, and I teach my medical students and residents this, we work together. We really work as a team to help take care of patients. And it's really important part, I think, in patient care that we're working together. So I think it's excellent and wonderful that patients are able to come to you all as a trusted healthcare resource to get flu vaccines too. And it's convenient as well. So
Thanks.
you're welcome.
I know I speak for not just myself, but I speak for a lot of our pharmacists out there, particularly our Rite Aid pharmacists. You know, we want to take care of the patients the same way you want to take care of patients. So we're working together to make sure you guys stay healthy. At Rite Aid, it really is our mission to improve the health and wellness of the communities we serve. And for us at Rite Aid, we really take this, and it is something that is personal to us.
Right. Yeah. No, and I appreciate that, because it's really personal to me too. It's why one of the reasons why I love working with you all on this flu shot campaign. So you know, you all play a really big role in the delivery of healthcare. We do as well, and I love the fact that, once again, just to reiterate, you don't have to wait to see your doctor to get a flu vaccine. You're shopping at Rite Aid, or you're driving past the Rite Aid, just wheel right on in there, and you can pick up your shampoo and your toiletries and get a flu shot as well. It's really not too late. So yeah, it's really important.
So I think, you know, if you're still looking for that closest Rite Aid, you can visit riteaid.com to find it.
Yes, yes. And I think we have a special section on the website, right? Isn't there a special section on the website where people can go and find out where? So riteaid.com.
Yep, riteaid.com, store locator, you can jump on there. I want to thank Dr. Caudle for joining me tonight.
Oh, thank you.
This was a lot of fun, and I really want to thank you guys for joining us as well tonight.
Yes, thank you guys so much. And we've loved your questions. Keep the questions coming. They're really, really great questions. So
hopefully everyone learned a little bit about the flu tonight, and you're able to take that information back and protect your family and protect yourself for this season's strains of the flu.
Right. And remember, if you haven't gotten your flu shot yet, you can still go to your local Rite Aid and get one. RiteAid.com, you can get your flu shot. So this was a lot of fun, Chris.
Thanks.
Yeah.
And on behalf of Rite Aid and myself, I wish you all a happy, healthy, and flu-free holiday season.
Happy holidays.